Hey guys, Dr. Josh Morter at Morter Family Chiropractic. So it dawned on me this morning, if you come in on a Monday, then you know I've listened to my research podcast in the morning and I come in all fired up and I'm sharing that information with you. But for the people that come in later in the week, or for somebody that's never been in the office, you never get to hear that research information. So today I wanted to shoot a video and just kind of share that with everybody. And this one I think is really important. This is titled What Your Spine Surgeon Didn't Tell You. And this was a study done in JMPT, and it compared candidates that had the microdiscectomy surgery to chiropractic care. So first, a little bit of background. These were all people that had MRI-confirmed herniated discs in their low back. They had all undergone at least a 3-month trial of other conservative care measures. So maybe that was medication, that could have been physical therapy, massage therapy, acupuncture. They tried other things and they hadn't worked. And so then they divided them into two groups. The one group had the microdiscectomy surgery. The other group went through chiropractic care. The big reveal on this is that chiropractic care produced the same results in 60% of the patients. So without surgery, we got the same results 60% of the time. Now that's important because 80% of Americans are going to have severe low back pain at some point in their life. We know from some other research that if they go to their primary care physician, a medical doctor first, vast majority of those times they end up in surgery. Whereas if their first point of contact for the same injury is a chiropractor, less than 5% of the time they're going to have the surgery. So same injury, huge difference in the outcomes and the treatments that are given for that. So let's talk about the microdiscectomy for a second. So I got my spine model here. So we're dealing with herniations in the lumbar spine. Typically what we've got is the bone above, the bone below, the disc in the middle. That's our squishy part. That's the part that moves so we can bend and twist and go through a range of motion. That's also our shock absorber. This is what it should look like normally. In a herniated disc, a piece of that has bulged out, pushed out, and can be putting direct pressure on this nerve. Incredibly painful, can cause foot drop and a whole host of other symptoms. So these guys are a serious issue. For the microdiscectomy, they're going to come in from the back, they're going to make a 1 to 3 inch incision, and then they're going to come in and they're going to trim this piece off. So immediate relief. They've cut that section away, so you're going to feel better right away. However, there's a healing process that has to take place afterwards. One of two things is going to happen. Either we're going to end up in some scar tissue along this border here and in the other soft tissues they've had to get out of the way, which can cause its own set of complications. Or at the very least, we're going to have a weak spot in the wall. When they cut this section away, they cut away the wall that holds all that material in. So now there's a weak spot. So there's an increased likelihood of having a second herniated disc down the road. So we really need to make sure that we've strengthened this area back up to prevent that. Of course, that's not an issue with chiropractic care. There is no surgery, nothing gets trimmed away. The other problem with that is once we've had the surgery, it's a bit of a burnt bridge. We go over that bridge, burn it behind us. We can't always do that again. So once we've had that surgery, that may be off the table for you as a possible treatment option. Even if you choose to go to a chiropractor after the surgery, now we have this scar tissue that we have to deal with. So there's another set of complications, things that can make the progress, the outcome less effective for you after the surgery. May still be tremendously effective. So I'd still encourage you to try chiropractic care post-surgery. But we've got another obstacle to deal with in our way. Now, the group that went through the chiropractic care, awesome outcomes, 60% of the time they did just as well. There was a small percentage that did not improve as well. So those people had the surgery after their trial of chiropractic care. The surgery still gave them an exceptional outcome. So they still got the benefit when the chiropractic care didn't work for them. That's an important issue, or an important point, because the people that had the surgery first may not have the same outcome with chiropractic, whereas those that had chiropractic first still had a great outcome with the surgery. So it doesn't go both ways. So all the signs from this study, if I break it down, they're telling us that we should exhaust our chiropractic treatment options first. So try different techniques, different offices, find a great fit for you. And then if it's still necessary, then we can go the route of the surgery. And I would encourage you to do other things for your back pain as well. Massage therapy, acupuncture, physical therapy, lifestyle modification. Those are all things that we deal with in our offices that we can help you tap into so that you get the best outcome possible. Now, of course, there are some red flag cases. Chiropractic care isn't an option for everyone. Some people do need the surgery right away. So we need to make sure that you're a good chiropractic for candidate care, for chiropractic care. So if you or a loved one, somebody you know, is suffering with low back pain and has had this stuff going on forever, go to our website, www.morterchiro.com. There's a blog, there's lots of information so they can learn about who we are, what we do, how we can help them. There's also a new patient special offer. So if they want to come in and see if they're a candidate in our office, they can take advantage of that. If you guys have any questions, comments, if you've been to a chiropractor and had a great outcome with chiropractic care, leave it in the comments below. Post your story. If you have any questions about anything I've talked about, put that below too, and I'll talk about that. I'll get back to you as soon as I can. But until next time, stay healthy, my friends.